All right, so did you guys know that 1 in 5 adults experience mental health problems? That means that in a classroom of 30 people, statistically speaking, at least 6 of your classmates are experiencing mental illness. Think about the actor Robin Williams. He's an award-winning actor that we know best for movies such as Aladdin, Mrs. Doubtfire, and the Dead Poets Society. He once said, "Everyone you meet is fighting a battle you know nothing about. Be kind always." Robin Williams is a great example of somebody who experienced mental health problems and hid it well from the public. A reason why I wanted to speak on this topic with you guys is because I work in the healthcare industry, and every day I see people struggling with mental health problems. I know how common it is within our own community, and I know that especially with recent events such as the pandemic, we can see how common the mental health problems are. One obstacle that we face when it comes to mental health treatment is the fact that mental illness is an invisible disease, meaning that we have to work extra hard in order to identify these signs and symptoms within our peers and be able to face that problem that way. Today, we're going to be exploring the history of mental health treatment, why we've been able to come so far, and how we can continue to be better. So because mankind has been around for such a long time, we're going to break this up into 3 big chunks. First off, punishment, then isolation, then rehabilitation. So starting off with punishment, all the way back in prehistoric times, people were trying to address this abnormal behavior through acts of punishment. For example, cave dwellers would drill holes in the back of people's heads in order to let evil spirits out. According to a textbook entitled Essentials of Abnormal Psychology, during medieval times, mental illness was explained by possession of the devil. And in order to combat this, they would use methods such as exorcism, flogging, and even so much as execution. One extreme example of this is the Salem witch trials, which was during 1692, where people who were exhibiting symptoms of mental health problems were accused of practicing witchcraft and therefore killed. Moving on from punishment, mankind started to use isolation as a possible solution. Baton Rouge Behavioral Hospital explains that these treatments were used on a socioeconomic level in order to push those who experienced mental illness out of society. These techniques included lobotomies, electroshock therapy, and experimental techniques that weren't backed by scientific evidence. Insane asylums, as they were called at the time, became hugely popular in the 20th century. This was most likely due to the fact that there was no accurate treatment for mental health problems, but there was still an increase of patients. Doctors during this time experienced even more pressure to find a solution, but they just didn't have the technology or science to back up their beliefs yet. Later on, we began to move towards rehabilitation. During this rehabilitation time, things really started to shift within the public. One big reason for this is things like literature. For example, Ken Casey's One Flew Over the Cuckoo's Home, written in 1962, began to give people a different perspective. The public was able to see mental illness from the patient's point of view and push for better advocacy for them. During the 50s and the 60s, there was a huge rush of deinstitutionalization and a better case for outpatient care, which in turn led to more medication as a treatment. Today, we're able to see evidence of this. For example, we have many movements going on that are pushing to lower the stigma behind mental illness. For example, we're able to look at mental illness not just as something that's in your head, but a physical illness as well. Doctors are looking at this rather than from a supernatural background or religious beliefs. They're looking at this with science and finding that there is chemical imbalances in our bodies. They're looking at the environments in which we grew up in that can affect your mental health problems. By looking at how we've transitioned from punishment to isolation to rehabilitation, we can see that monumental progress that we've made as a society. Now that we know this knowledge, what can we do about it? What are some questions that we can ask ourselves? We can ask ourselves, how are we willing to advocate? How are we going to advocate for others or ourselves that are experiencing these mental illness? Another question that we can ask is, how can we open the conversation? How can we get rid of that stigma behind mental illness and make it known that it's not rare that many of us experience mental health problems. By looking back on where we came from, we're able to figure out a path to answers. We're able to find more solutions for this problem. I've taken us back all the way to prehistoric times to now so that we can get a better look at where we came from and see where we can go in the future. With better technology, we're able to look closer at this invisible disease. With this, we can move forward, and I hope that you can find more motivation to look closer around you and even in yourself. And if you are one of the 20% of adults who experience mental health problems, I hope you feel safe and open to coming to your peers, friends, or family for advice or understanding on the topic. Thank you guys for listening to me again today, and it's been a pleasure hearing from you guys. Thank you.